excessive ventilation.
Very important. Avoid excessive ventilation. So you have to give the breath for 1 second till you see the chest rise. Don't force the air in. But in these mannequins, we may have to force the air in because the air doesn't go in. Till the time you don't see the chest rise, you have to force the air in. Only in here. But in real human, the contact is going to be very nice. And as soon as you give the breath, the chest will rise.
You can see it in a human?
In a human, yeah, same way. I'm going to show you how.
There's no pulse. 1, 2, 3.
CPR begins with compressions. Because compressions are so important to a victim's survival, they need to be started immediately, within 10 seconds of recognition of cardiac arrest. Early CPR keeps the oxygen and blood flowing to the heart and brain, creating valuable life-saving time until spontaneous circulation is restored.
1, 2, 3.
To be most effective, CPR should be performed as a team with rescuers completing many tasks simultaneously. However, in order to be an effective team member, you need to master the individual skills of one rescuer's CPR.
Let's switch now.
For this training, we will isolate the individual skills rescuers perform and then put them together, so you'll be prepared to deliver high-quality CPR and use an AED as a team.
Coming through. Stand back, please. Scene is safe.
The first step of BLS is assessment and scene safety. The first rescuer who arrives at the side of the victim must quickly be sure that the scene is safe. The rescuer should then assess the victim for a response and breathing.
Hey, are you okay? Can you hear me? He isn't responding. Isn't breathing normally, just gasping. Grab the AED.
If the rescuer is alone, he or she would then call for help and get the AED. The next step is to check for a pulse. To perform a pulse check in the adult, feel for a carotid pulse.
No pulse.
This technique is usually easier to perform on the side near the rescuer. Locate the trachea using 2 or 3 fingers. Slide these fingers into the groove between the trachea and...
So if you are sitting on the right side, you're going to see right side of the neck. If you are sitting on the left side, you see the left side of the neck. Don't cross over on the other side of the neck. Alright? Take your fingers between the windpipe and the muscles. Turn it to the left side.
the muscles at the side of the neck, where you can feel the carotid pulse. Perform the pulse check for at least 5 seconds and no more than 10 seconds. 3. If you do not definitely...
So how long do you see the pulse rate?
No longer than 5
to 10
seconds.
seconds. Alright? At the most, maximum will go for 10 seconds. For 5 to 10 seconds, you're gonna look for the pulse. Maximum 10 seconds, minimum 5 seconds. If you don't feel the pulse, you start the CPR.
Definitely feel a pulse, immediately begin CPR, starting with chest compressions, CAV sequence. Now we're going to learn how to do chest compressions. Just watch now, we'll practice momentarily. Position yourself at the victim's side and make sure that the victim is lying face up on a firm, flat surface. Quickly move or remove all clothing from the front of the chest. You will need to be able to see the chest and later attach an AED to bare skin. Put the heel of one hand on the center of the bare chest over the lower half of the breastbone. Then put the heel of your other hand on top of the first. Your shoulders should be right over your hands and your elbows should be straight.
See that? Which hand goes down and which hand goes up?
The right one.
The right
The
hand
right
goes down,
is
the left
more-
hand go outside.
Whichever is good for you. It doesn't really matter, but whichever is good for you, whichever way you feel comfortable. If you're left-handed, your left hand will go down. If you're right-handed, your right hand will go down. But you have to lock your fingers like this. And you have to keep your elbows straight, just like this. Don't bend your elbows. If you bend your elbows, you'll get more tired, you're going to use your muscles. If you keep your hands straight, you will not get tired. You will use your body weight. If you bend your elbows, your body weight is going to fall on your muscles. You won't be able to perform CPR for more than 10-15 minutes. Alright?
Push hard and fast. Press down at least 2 inches or 5 centimeters with each compression. This requires hard work. For each chest compression, make sure you push straight down on the victim's breastbone. Deliver compressions in a smooth fashion at a rate of at least 100 compressions per minute. At the end of each compression, make sure you allow the chest to recoil completely. Chest compression and chest recoil times should be approximately equal. Right now, we're going to pause the video to allow you to get into position to practice with the mannequins and learn the skills of CPR.
All right, one light you can turn on.